WonderBio. Ultra-sensitive bioelectronic nose-based IoT solutions for early diagnosis of cancer. Wearable IoT solutions for early self-diagnosis of cancer. Portable early cancer diagnosis IoT solutions for hospitals. According to Professor Yang Han Kwang, director of the Cancer Hospital at Seoul National University Hospital, SNUH, as a country becomes more economically advanced, mortality rates related to infection, cardiovascular disease, and other health issues that can be treated with drugs or interventional procedures tend to decrease, leaving as yet unconquered cancer as the leading cause of death. In many types of cancer, late diagnosis is the primary reason for poor prognosis. So if we can develop ways to recognize cancer more easily and at less cost, it will greatly contribute to improving cancer treatment. According to Professor Koo Kyo-chul of Prostate Cancer Center at Yonsei University Gangnam Severance Hospital, in most cases of prostate cancer, there are no early symptoms, so a test using prostate-specific antigen, PSA, a serum tumor marker, is particularly important. However, PSA has high false positive and false negative rates, making it necessary to develop an alternative prostate cancer tumor marker. That's right. There's an urgent need to develop a new early cancer diagnosis technique. Professor Park Tae-hyun at the Seoul National University School of Chemical and Biological Engineering noted the following. Cancer causes substances with specific scents to be released through the patient's respiratory system or skin. So if we can detect a trace amount of such gases during the early phase of cancer, we can ensure an early diagnosis. WonderBio's e-nose sensor is so ultra-sensitive that it can detect the smallest amount of cancer-specific gases produced during the very early phase of cancer, and therefore offer possibilities for early cancer diagnosis. Our Bio e-nose sensor is sensitive enough to detect a biomarker with an ultra-low concentration, equivalent to that of a single drop of blood in an Olympic-sized swimming pool. As such, it is more sensitive than a dog's olfactory system. WonderBio is an innovative biotech company that can produce biosensors that can detect cancer-specific gases during the early phase of cancer, sensors more sensitive than disease detection dogs. According to Dr. Song Kyun-sok of KIST, until recently, the global bioengineering community had believed that it was impossible to mass-produce biosensors by cloning olfactory receptors. However, WonderBio succeeded in mass-producing nanodisc-type olfactory sensors, the type considered optimal in terms of olfactory sensory performance. According to Professor Kong Song-ho at the Seoul National University Hospital Gastric Cancer Center, in countries where there is no state-run cancer screening program, or where cancer screening is expensive, cancer is often detected too late. In particular, gastric cancer often has no symptoms until it progresses too much, or it is indistinguishable from ordinary gastritis. So in many countries, gastric cancer is only detected in its most advanced stage, stage 4, more than half of the cases. In Korea, the National Health Screening Program, NHSP, recommends an endoscopy test every 2 years. However, if the screening should fail to spot anything amiss, the cancer can grow for up to 4 years without detection. But if the endoscopy test is complemented with a breath test, the success rate of early cancer diagnosis will increase. In this respect, WonderBio's new technology is expected to enable early cancer diagnosis thanks to nominal cost and time. More frequent testing can indeed raise the likelihood of detecting cancer early. But the traditional diagnosis methods, while effective, are expensive. Moreover, test-related risks, e.g. test-related complications and increased radiation exposure, and limited medical resources must also be factored in. If a new test is developed that can complement traditional cancer diagnostic tests with less economic or physiological burden, it can be used more frequently than traditional tests. It will then be able to increase early cancer detection rates or partially replace traditional tests if performance proves to be outstanding. Our researchers at WonderBio will suggest a new paradigm in early cancer diagnosis by offering ultra-sensitive bioelectronic nose-based IoT solutions. With help of our ultra-sensitive biosensors superior to the canine olfactory system, we will do our utmost in detecting cancer earlier than any other test. We will further develop our technology for mass production of olfactory receptor sensors to ensure that everyone across the world can benefit from new and affordable early cancer diagnosis technology. Steadily enhanced over the past decade, our third-generation biosensor model, to be commercialized now, will be welcomed by the world as a breakthrough in vitro diagnostic test of cancer. Finally, Team WonderBio declares its mission henceforth. First, we will develop bioelectronic nose sensors for early diagnosis of major cancers, starting from those related to gastric cancer. Second, we will develop wearable early cancer diagnosis IoT solutions for self-diagnosis. Third, we will develop portable early cancer diagnosis IoT solutions for hospitals. Through these goals, we will strive to decrease the total number of victims from cancer throughout the world as early as possible. Ultra-sensitive bioelectronic nose-based IoT solutions for early diagnosis of cancer. Wearable IoT solutions for early self-diagnosis of cancer. Portable early cancer diagnosis IoT solutions for hospitals. The shortcut to overcoming cancer. WonderBio.